Good afternoon and welcome. This is Elizabeth Hardig with the American Planning Association. And we're excited to have you all here this afternoon to learn more about health equity and community engagement. So as you know, this is one of the Plan4Health webinars in our webinar series. I did notice a few new names as folks were entering the room, so I did want to take a moment and just share a little bit about the Plan4Health project. So Plan4Health is a national initiative between the American Planning Association and the American Public Health Association. Plan4Health connects communities across the country, funding work at the intersection of planning and public health. Each of our sites are anchored by APA chapters and APHA affiliates, doing fabulous work at the intersection of planning and public health, as I said, and really focusing on nutrition, access to healthy foods, or physical activity, increasing opportunities for physical activity. These coalitions work with communities to build sustainable cross-sector partnerships. For those of you who were able to join us in December, we had a wonderful Health Equity 101, and today is really meant to build on that and take a deeper dive into how do we connect with communities. Our speaker today is Tia Taylor from the American Public Health Association. Tia Taylor is a program manager at APHA, where she manages a portfolio of projects aimed at addressing the social determinants of health to reduce health inequities. In addition to providing project oversight, Tia has authored and shepherded the development of reports, issue briefs, and fact sheets, including Better Health Through Equity, Case Studies in Reframing Public Health and Health in All Policies, a guide for state and local health departments. Tia has over 12 years of experience in public health and holds a Master's of Public Health from Virginia Commonwealth University, a Master's of Science in Nutrition and Integrative Health, and a Bachelor of Science in Exercise Science from Ithaca College. Tia has served her community in multiple capacities, with the most rewarding being as a court-appointed special advocate for abused and neglected children in the foster care system. Tia is dedicated to promoting policies and practices designed to allow all communities to thrive, and we are certainly pleased and honored to have Tia here today to introduce this topic to you all. I think I heard a couple more beeps as I was welcoming everyone, and I just wanted to now take a moment to touch on a couple of housekeeping items. You'll notice there's a chat box on the right-hand side of your screen, and we definitely encourage questions throughout the webinar. We will have time for discussion at the end, but don't hold back. We're happy to respond as we move forward. And this webinar is being recorded, so we will have a copy of the webinar on our archived events page on the Plan4Health website. And for those of you who are new to the project or who haven't had a chance to check out the website lately, it is there in the chat box, www.plan4health.us. All right, well, enough from me. I'm ready to hand things over to you, Tia, if you are ready to get started.
Great. Elizabeth, can you hear me okay?
I can, yes.
Great. Well, thank you for the invitation to present on this webinar, and good afternoon, everyone. As Elizabeth mentioned, my name is Tia Taylor. I'm Program Manager in the Center for Public Health Policy here at APHA. I oversee and coordinate our health equity work, which is really, I really do emphasize that role of being more of a coordinator because APHA over the past few years has really tried to strengthen our internal capacity so that all staff are able to apply an equity lens to our work. So I help to coordinate both that internal effort because having the capacity to see things through an equity lens is key for helping to create programs, strategies, and policies that promote equity. In addition to our internal work, I help to highlight what's happening on the ground. So there are a lot of really innovative and effective interventions that are happening across the country. And, you know, as a national organization, we have the reach to be able to disseminate those strategies to various audiences. So we really see our role as helping to lift up what's working as communities tackle inequities and create health equity. But based on that work in terms of dissemination and collecting stories, there are some common themes that continue to arise among successful efforts to create health equity, and meaningful community engagement is a key component of those efforts. If anyone has trouble hearing me, please use the chat function, but I'm doing my best here. So this is a definition of community engagement that I really like because it focuses on the benefits to the community. Community engagement is a process through which community members are empowered to own the change they want to see. It involves communication, problem solving, governance, and decision-making skills and strategies. And this is out of a toolkit from the Policy Link and the Kirwan Institute around community engagement for sustainable communities. So why engage the community at all? Community engagement, when it's done appropriately, it can harness the skills and talents of a community's most important resource, its people. Effective community engagement creates legitimacy and increased support for your plans and projects. It can also foster connectedness and trust. By creating a process built on relationship building, trust, respect, and affirmation of community knowledge and power, you will unveil more effective ways of dealing with differences. Community engagement can also improve community and government relations, building diverse stakeholders, and helping to improve the quality of difficult discussions about racial disparities, economic conditions, and community development needs. The reverse is also true. Failure to engage the community in a meaningful way can have the opposite effect, causing more mistrust of government, more mistrust of your agency or your coalition. It can actually lower the capacity of the community, lower their sense of empowerment to actually make change. So the focus on meaningful community engagement is what we are talking about today. So as Elizabeth mentioned, you all got a great presentation last December from my colleague John McIntosh about the importance of applying a health equity lens. But I just wanted to revisit that. That lens is something that also needs to be applied to your community engagement efforts because, you know, health equity doesn't have a trickle-down effect. And you've probably seen variations of this graphic here about what happens when we give everybody the same thing. It doesn't actually result in the outcomes that we are aiming for, which is everyone having equal access and opportunity. Sometimes equity means that sometimes we have to give more resources and we have to give more attention to certain groups and certain populations in order to really level the playing field. And without being explicit about equity and without disseminating resources according to need, you can actually have the unintended effect of widening gaps and disparities. So I'm going to focus on a couple of areas that have emerged across different interventions that have been effective in engaging the community with a health equity lens. And one of the first things that is important for applying an equity lens to any work, but especially for engaging the community, is to start by assessing and addressing organizational barriers to community engagement. So organizational barriers include everything from time, financial resources, staff capacity and skills, and partnerships. Some organizations may be reluctant to engage the community due to the time commitment, the staff skills needed, and the ability to demonstrate effectiveness. There may also be concerns about the effort becoming unmanageable. To address these concerns, you should develop an engagement plan that provides a systematic approach to conducting engagement activities. And this is where your partners can really be helpful. Many of your partners probably have established relationships that you may not have with the community, and this is an opportunity to lean on them. So some questions you may consider is kind of, what is our timeline? What budget do you have for community engagement? And what is the staff capacity to engage the community, particularly with a health equity lens? So this is I like this graphic because I think it's important to know that there are multiple levels of engagement. And yet the level of engagement will depend on your goals, time constraints, the level of program and community readiness, and capacity and resources. There's no one right level of engagement, but considering the range of engagement and its implications to your work is a key step in promoting community participation and building community trust. Regardless of what level of engagement you decide on, your role as well as that of the community and your partners should always be clearly defined and transparent. And I noticed that the Seattle-King County, through their Equity and Social Justice initiative, they've adapted this graphic to suit their needs, and I think it's a really good demonstration of the different levels that you can engage the community. So under staff capacity, applying an equity lens and building the capacity to see things through an equity lens is really important for this work. And one of the steps that is often overlooked in the process is assessing readiness. Assessing the readiness of your organization or your coalition to do equity work. These are listed here on the slide are characteristics of organizations who have embedded equity considerations into their work. It's, you may want to think about whether or not you have leadership support. So that could be the support of your organization or support among the leaders of your coalition, because this is a process. Applying an equity lens is an ongoing, long-term process, and you're constantly learning. And so it really requires commitment. And with commitment often comes the need for sustained resources to the process. And then also the willingness to be uncomfortable. Talking about inequities, racism, and other forms of privilege and oppression is not always uncomfortable, and it can often put people on the defense. But it's vital to gaining and ensuring that we're addressing the root causes as we're developing our interventions. It may not always be possible to do all of these things, to have the leadership support, and many efforts can start from within a coalition and that doesn't involve leadership, but it really should, at some point, leadership buy-in is important for sustainability. The other aspects of applying an equity lens include defining equity. Defining it and also educating those involved about your definition so that there's common language and everyone knows that they're working towards the same thing. And also having equity be a key principle and practice for affecting community change. If you're applying an equity lens, it's important to understand why disparities and equities exist within your particular community and what are some of the root causes of those. It's important to be explicit and be explicit about what your outcomes are, but also not be afraid to address the isms. So naming and addressing racism, talking about privilege, those are things that can't be ignored if you really want to actually affect change and address equity within your community. And then the other key part of that, which is the point of this webinar, is to really make sure that the groups that you are hoping to engage and affect the groups that are affected by your program and whatever you're proposing, that they're actually a part of the process and that they're at the table. So here are some tools for understanding health inequities that you could build into your strategy for improving your internal capacity. And these are a few things that come up over and over again as we talk to different communities about how, different communities and different organizations about how they're building capacity for a health equity lens. The first two are documentaries. Unnatural Causes is Inequality Making Us Sick, and Race, The Power of an Illusion. And both of those are, parts of those are available online. You can also purchase the videos as well. And they come with discussion guides that you can use to really help open a dialogue about inequity and create a safe space where people feel comfortable or feel open to discussing these issues. Many of the communities that we've spoken with have used one or more of these tools in helping to get the conversation started. NACCHO has a Roots of Inequity curriculum, an online curriculum that you and your partners and community members can actually take. That's really helpful. www.racialequitytools.org is, they have an extensive library of curricula, tools, and other resources for applying a racial equity lens. And some of these others you may be familiar with. The Project Implicit has several implicit bias tests that are helpful to get conversations started about people owning their own biases that can translate into how we interact with communities. Root cause mapping is something that can be integrated early on in the process. And this graphic is taken from our Health and All Policies guide. And it's really a strategy for helping to identify key factors and the root causes of a lot of the conditions that we hope to address. The root cause mapping involves repeatedly asking why to help identify the cause of the causes or the social determinants that you seek to address. As I mentioned before, this can be really useful in the beginning of a process as it helps you to see mutual benefits, both community benefits and the benefits of your coalition or your organization in terms of the intervention you're hoping to implement. It also may be helpful for you to think about if you are encountering barriers with engaging the community. This process of asking why might help you to, and mapping that out might help you to come to some solutions, some root causes for the lack of engagement of communities, particularly communities of color with your intervention. So another staff skill, staff capacity that I wanted to talk about is this, the idea or the concept of cultural competence. And I wanted to say that equity and cultural competence are not mutually exclusive. Equity is more foundational, and the ability to apply an equity lens strengthens your capacity for cultural competence. Cultural competency is an essential foundation for community engagement. It builds multicultural relationships and prioritizes different types of knowledge. It focuses on 3 dimensions: awareness, beliefs, and behaviors. And we'll go through those a little in more depth. So awareness. Awareness is the ability to recognize and understand the reasons for the actions of individuals from your culture or from another culture. Awareness elements include self-awareness, specifically that you recognize your own perceptions and your ability to get new information is limited by your experience. Individuals who are self-aware have a better understanding of how the world sees them and how they in turn see the world. Awareness also involves awareness of others' cultures and beliefs and their behaviors. Awareness of the social and economic and other environmental factors that maintain or change one's cultural beliefs and or behaviors. It also involves the awareness that individuals are both distinct and multiple cultural identities. Every individual is a member of multiple groups that includes gender, race, ethnicity, and profession. The experience of having multiple identities as well as innate characteristics causes individuals to have beliefs and engage in behaviors that depart from the stereotype of that particular culture, of a particular culture. And awareness also involves being aware that the complexities and dynamics of multiple cultures and organizations, and because of that, one is never fully cultural competent. It's a continual learning process, and understanding that is a part of developing the capacity for cultural competence. Cultural competence also involves beliefs, which are judgments about the world that shape how individuals determine what is valid and what sources are reliable. We rationalize our behaviors through our beliefs. Examples of culturally competent beliefs include valuing differences among people and groups. Culturally competent people do not just tolerate difference, they seek it out because they believe that diversity will lead to better outcomes. Believing that another culturally competent belief includes the belief that individuals should suspend judgment when examining the beliefs and behaviors of other cultures. This isn't to say that you should tolerate or support every behavior of every culture, but everyone should be assessed and given full attention before you evaluate them. Another belief is that individuals act rationally according to their own set of cultural beliefs. We act based on what we value most. And our challenge in our attempts to become more culturally competent is to understand that that value structures and hierarchies of people who differ from us. Finally, cultural competence involves behaviors, which are actions that flow from awareness and belief. Individuals demonstrate their cultural competency through a variety of behaviors, including communicating effectively across cultures, seeking diversity in problem solving and group activities, and taking actions to promote cultural competency in others. So some strategies for building cultural competency, including having dedicated resources within your plan for training around equity, diversity, and inclusion. Some other strategies include, attending community meetings and cultural events as a participant. Listen to how issues of the communities are discussed. Listen to what their priorities are. This also involves, letting go of your agenda and really trying to become more integrated within the community, which will help inform your efforts. Engaging community-based organizations and other groups representative of the community, as well as individual community members. And of course, if you are working with a population who has a primary language other than English, translating materials and providing interpreters at community meetings. Another thing about the community organizations is to look at your coalitions to see who's a part of it and who is not. Are there faith-based organizations that you have as partners? Those groups often have strong ties with the community and are really important partners to have as a part of your coalition. Also, if your intervention or what you're trying to do affects youth, the youth should be a part of your coalition as well. So once you have a post on what the your organizational capacity is, understanding the history of the community is key. And this is also something that's a part of applying an equity lens. Achieving health equity requires an empathetic approach that acknowledges a community's history, respects its traditions, listens to its stories, and actively engages its members in any intervention. Ensuring that you are not perpetuating inequities, you have to ensure that you have to acknowledge that government and public policy has played enormous roles in perpetuating the biases, injustices, and inequalities that create health inequities. Be aware that many communities are still experiencing the effects of historical trauma. This is important, and it's why it's essential to go into the community without an agenda and with an open mind. In addition to the history, you also want to look at the current climate. What is the current relationship among community members? What is the relationship among the community and government? That's particular, we hear a lot right now about community and law enforcement relations. Those are things that you should be considering when you're thinking of engaging the community. Also, the effects of gentrification, particularly in urban areas, and how that might impact the community's willingness or readiness to be engaged in your efforts. The other part of understanding the history is looking at past community engagement efforts. What has worked, what hasn't? How is your organization received, and how are your partners received? Examine past engagement efforts to understand any issues and to learn what has worked, what has been less successful. Try to get an accurate picture of your organization and how its engagement strategies are perceived, and work with community leaders to address any barriers to engagement. Building relationships early and consistently, that's key, and I think that's something that many of you have already done and are continuing to do. Community engagement takes time and requires an ongoing commitment from everyone involved. Establish and maintain strong relationships with communities experiencing health inequities before funding opportunities arise or urgent health issues develop. Begin with organizations that work with these communities, building them into your coalition structure, which I know many of you have, and giving them decision-making authority, and also using those partners to conduct community engagement processes with residents. Keep in mind that individual residents are important, but they aren't representative of everyone. Engagement with both residents and organizations is necessary for a legitimate process that's built on trust, and their collective engagement will result in a better process altogether. Selecting appropriate engagement techniques. I took this from the Minnesota Department of Health. They have a really great toolkit on community engagement. The link is here. And they really go into more depth about each of these different strategies, when they're beneficial, when they're less helpful. And they also have another tool that I'll mention in a little bit that can help you, can walk you through a series of questions to determine which of these techniques might be most helpful depending on where you are in your efforts. Consider engagement techniques based on the purpose and the length of the engagement, as well as the resources available to you. Something about technology, if you're thinking about using technology as one of your engagement techniques, these are a couple of questions that you may want to ask, particularly if you're working with under-resourced and marginalized communities, non-English speaking communities. These are just a few questions that you can can walk through as you're putting together your strategy. And this chart just kind of is another process that you can walk through to, based on where you are in your engagement, certain techniques or tools may be more effective. And it also depends on what your goals are. So if you're pretty far along, your plan has already been developed, and you mainly want to engage the community to help build consent for your project or plan, or help to further fine-tune your plan, some techniques or tools that may be helpful are getting representatives from the community to serve on your advisory group, having one-on-one contact with community members, community-based organizations, and having working meetings where you can actually go through the plan and get community feedback on those. Understanding and addressing barriers to participation. Consider that populations experiencing health inequities and some of the barriers they may face with engagement efforts. And those are some of the common ones: the timing and location of your meetings, the language that you're using. So that's not just whether it's English or another language, but the technical language that's being used. And is it accessible for the community? They may have family demands, or they may be unclear of what the value or the purpose of their participation might be. So to address those things, respect community's time and efforts by having a clear and agreed upon purpose for engagement. Be transparent about the information you're collecting and how it will be used. When necessary, conduct meetings in native languages or provide interpretation or other services needed to address language and cultural barriers, and conduct engagement activities at times and places that are convenient to the community. You may need to provide meals, transportation, or child care services. One of the key components of a meaningful community engagement is that you support and build community capacity. Community engagement can only be sustained by identifying and mobilizing community assets and strengths, and by developing the community's capacity and resources to make decisions and take action. Community members and institutions should be reviewed as resources to bring about change and action. Community members are a vital asset for broader community improvement and may have a long-term interest in the community's well-being. Choose engagement activities that build on their capacity. And these include bringing the community members into coalitions, looking around to see who's at the table, as we mentioned before, and if the most affected communities are not represented, inviting them to the table. Including the community in training and educational activities, so including representatives from communities and community-based organizations in your trainings on diversity, equity, diversity, and inclusion. Having leadership development training for community members. Coaching them on public testimony and other ways to engage in advocacy processes. And the other thing that's important for that is if you're engaging the community, you should make sure that whoever's doing your training or facilitating has an equity perspective. Finally, valuing community and technical expertise. Many communities benefit from engaging individuals and organizations with technical expertise in certain health issues. Such expertise can provide lessons learned from other initiatives in other settings, as well as guidance to avoid unnecessary barriers in implementation. However, it's critical that the expertise and the perspective of community members, those who are ultimately impacted by the initiative, are respected and valued when engaging with such technical expertise. So here's some ideas about how you can demonstrate that you value community expertise. And that goes back to involving them at all levels of the project's development and implementation. If you're hosting working meetings, allowing community members to define the agenda, allowing them to organize and lead those convenings, and then allowing them to have a say in what unrepresented groups get invited to the table. Communities are also really helpful for working with the technical experts to develop a common language. So I know that many of you are working under a time crunch. You have your coalitions and you have, time. You don't have as much time to do some of these things, although you're probably doing them in other areas. So some ideas for if you don't have the luxury of time. So really look at your coalition and ask yourself a few questions. Does it include organizations representing low-income communities and communities of color? Is there racial and ethnic diversity among your coalition members? Again, asking who's missing from the table. Safety is a big issue for a lot of community members. So do you have partnerships with law enforcement or have community groups focus on safety included as a part of your coalition? Which of your partners have the most meaningful relationships with the communities? They might be the ones that are in the best position to help lead your community engagement efforts. Again, with a time crunch, you can go back to this chart or this diagram that helps you be clear about what your level of engagement needs to be. And being more defined and transparent about that would also help your efforts. You can also use this as an opportunity to lay solid groundwork for future efforts. So be transparent with the community about the limitations on your resources, the limitations on time, and encourage them to stay involved with the process because they'll be able to shape future work. So, even if you are unable to, you've already got your plans underway, and hopefully you engage the community in that process, but you aren't limited based on time to put into developing relationships that will support future efforts. You can continue to build your organizational and coalition capacity to do equity work. So continuing to have those difficult conversations, continuing to build that capacity. Maintain your involvement with community organizations and residents. So trying to maintain a presence within the community by going to community events and cultural events as a participant to show your dedication to really promoting sustainable change and really staying entrenched into the work of the community. And I mentioned before, you can continue to stay involved with the community because this can help you generate ideas for future work so that the next funding opportunity that comes up, you will have a better sense of what the community's priorities are, and the community will feel like they have as much buy-in into that process. This was a tool, and I'm sorry, you probably can't see it very well, but I have the link here. This is included in the CDC's Practitioner's Guide for Advancing Health Equity, and it's a checklist that I think is particularly helpful if you are kind of midway through your process and are really just starting to think about your engagement strategy. This is a series of questions that you can go through that might be helpful for you, and I'll just read a couple of those because I know they're hard to decipher from the graphic. The first one is, where are we now? What existing relationships do you have with populations experiencing health inequities? What is your current process or plan for engaging community members? And are you using language that facilitates or creates barriers to engaging the intended community? Another set of questions focus on the approaches that you can use to effectively engage community members. And this goes back to looking at what you've done in the past, what your partners have done in the past, and were they helpful. And I think that's it. I know we're going to open it up for questions. Elizabeth, do you want to do that via the phone or via the chat function?
Thank you, Tia. That was really fabulous. I think we could probably open up the phone lines as well as the chat. I think we have a nice number of folks on the line, but not too many. So please feel free if you'd like to ask a question over the phone line or send a question in using the chat box. Either way would be fine. While folks are thinking of their questions and maybe reflecting on your presentation, I just wanted to thank you for providing some specific examples, translating materials and steps we can take right now to engage groups down the road. And we do appreciate you acknowledging that the Plan4Health timeline in particular is very, very tight. And so thinking about health equity as something that could inform future projects or the next round of applications or looking ahead is a great way to increase our sustainability, as well as to remind us that even though this deadline is coming up soon, we're part of a larger movement to support healthy, vibrant communities. So thank you for that.
You're welcome.
I know you mentioned Seattle, King County, as being a great example of a city that was really incorporating health equity in all of their policies and their approach. Do you have any other specific case studies, or are there any examples that come to mind that you would recommend folks take time to maybe read or to look up?
Sure. There are a number of them in the health equity case studies that I know are posted on the Plan4Health website, and that Sean McIntosh, she went over a few of them in the December mini webinar. So there are a few in there. Multnomah County is one, and they have a tool actually on their website, an equity and empowerment lens tool. I have to say that I think there are a number of tools that are out there, and many of them are great, and some of them are quite lengthy. So it gets back to the idea that this is not a short-term process. It's a long-term. So I can provide links to some of those tools, and many of them are actually on that racialequitytools.org. So Multnomah County is one that stands out. There's a lot of really great work happening across the country. Boston and Boston's Public Health Commission has done quite a bit of work building their internal capacity to do this work and engaging the community and helping to develop its priorities. That all parts of the commission are responsible for promoting, reporting how they're making progress towards those community-defined priorities.
That's a great point, tying in evaluation and measures of progress into this work. So we're holding each other accountable, and it's not just a box that we check off, but a continuous process that we report back to the community so that they're monitoring us and know that we're in this for the long haul. It looks like we do have a question through the chat box.
So Katie says, do you know of any towns or municipalities that have done a good job at leading authentic community engagement efforts? Other than the ones that I've mentioned, I don't have any other examples.
Seattle, King County, which was already mentioned, has done an amazing job. This is Sean McIntosh talking right now. They really have done an amazing job, and they've actually created some really wonderful tools. We're actually going to be approaching some of the leaders of those efforts to see if they are going to be willing to be mentors as part of the peer learning network. And so hopefully you'll have the opportunity to actually learn from them a little bit one-on-one. Because I think it's better, it's better to learn directly from the people who've done the work, and we're really hoping that they'll be able to talk to you more in depth about the work that they've done. But we can also share some of the tools that they have used on the Plan4Health website.
Mm-hmm.
And so we'll make sure, like, community living assessments are wonderful. There is a case study on community living assessments, which is really wonderful, that David Goldberg did. It's really wonderful. We'll make sure to link to that. We did a webinar that he delivered that talked about how they engage the community, and I think that's already on there, but if it's not, we will make sure that it is.
And Seattle County also has, I believe it was sometime in 2015, maybe mid-2015, they released a Equity and Social Justice Index, and I believe that there are specific strategies related to community engagement in there, some best practices and also some metrics. So I can make sure that those are also added to the resources if they aren't already.
That would be fabulous. Thank you. I think sometimes when we're thinking of examples about community engagement, we do tend to lean more toward those urban areas. So Seattle and Boston, I think it sounds like, have made some great strides in making sure that community members are part of the entire process and really authentically engaged. I know that in this round of Plan4Health grantees in particular, we do have more rural communities, and so community engagement in a smaller town might look a little bit different, but all of those same principles would of course translate and apply. Do you happen to have a rural example that comes to mind as we're kind of thinking about just some case studies to share with folks?
We don't actually have a case study on them yet, but I will say that I was very impressed with Tucson's efforts in Ajo and the process that they use. And there is a very specific process to use in engaging the community. And they've been doing it for years and years. And I think at some point we did ask if they could do some sort of blog post or toolkit chapter. And so I'm hoping that they will do that because it's very rural there. And they do understand how to engage the community in a rural area. And it is a little different.
That's great. Thank you. And I think even for me, just to see the slide that you shared, Tia, with all of the different community engagement techniques, the listening circles, or the focus groups, or even one-on-one conversations, I think that's just really helpful to keep in front of us and try to figure out which technique might make the most sense for where we are in our project.
Yeah, and I think that I linked to it, the Minnesota Department of Health has a worksheet that kind of takes you through a couple different scenarios based on your program, your project scope, timing, and what you're hoping to achieve by engaging the community, and it recommends different engagement techniques based on that. I found it to be a useful exercise.
That's great. I think we've heard from Plan4Health coalitions in both cohorts really an emphasis on focus groups and kind of smaller opportunities, but it's nice to expand our toolbox and have such great resources at our fingertips.
Mm-hmm.
I think another piece of this work that is certainly something that fits well with the Plan4Health and CDC logic model for our project is making sure that our language is very accessible. So translating, of course, is important, and I think something that we should always be thinking about, but really figuring out how to get away from our own jargon. And I know that for me personally, I've spent a lot of time thinking about that with PSE work in general, and I can't help myself when I say built environment, and I know that doesn't resonate with everyone. And so I thought that was an interesting point to bring up and to remind us that as public health professionals and planners, this kind of jargon becomes so normalized that sometimes we forget just how much of a barrier it could be to folks who are just coming to the table, who are thinking about this work in a different way.
Absolutely, and that's where the valuing the community members as experts can be really key in helping to develop a language and getting that will resonate with the community, that the community understands, and kind of moving away from the jargon that may be off-putting.
Mm-hmm. I think one of my other kind of favorite parts in this presentation was really the willingness to be uncomfortable and to recognize that in order for us to do, just as you said, Tia, make sure we recognize the expertise of the community members and we have this open mind and we don't come in with our own agenda, that for some of us, certainly myself included, I enjoy having a plan of action, but it's good to be uncomfortable, and that's a sign that perhaps we're willing to step out of our own comfort zones and to take on some tough conversations. I think you're absolutely right, kind of naming those isms and having these discussions can be very intimidating and sometimes maybe prevent us from truly engaging new partners or pushing the conversation in a new direction.
Absolutely. Hey, Elizabeth, I just thought of some other examples of community engagement that are on APHA's website, and I'll make sure that they're linked on the Plan4Health as resources. We did a series of webinars on food sustainability that had a lot of really great projects highlighted on access to food in rural areas that were wonderful examples of community engagement and community-driven projects.
That's great. Thank you.
Yeah. I'll make sure that those are on the Plan4Health website.
Fabulous. So I think for me, really my last question, and certainly other folks feel free to chime in and chat or ask over the phone. I liked the notion of the root cause mapping. I thought that was a really great way to visually represent these barriers that we're thinking about and really move away from the conversation about the individual and that individual programming approach to more of a PSC space. And I just wondered if you could talk a little bit more about your experiences with root cause mapping or any recommendations for folks who might want to tackle that as an engagement technique.
Mm-hmm. So I find that root cause mapping is a great tool for demonstrating just what you mentioned, and that many of the contributors to poor health outcomes are way beyond the individual, and it works with multiple sectors. Our partners in California at the California Health and All Policies Task Force used root cause mapping as one of their very early activities when they were bringing the task force together. And the mapping exercise was a way for all the different sectors to kind of see how their work impacts health, and it helps the task force start to develop a shared vision, and it started to identify what we call win-wins or co-benefits. So I think it's an exercise that can be done with a really diverse group. I think it can be very productive and also help to uncover different viewpoints and priorities. It's something that should be done as early in the process as possible. Do you have any? Great answer.
Great, thank you. And I think that's especially relevant for this type of cross-sector work, really being able to bring in different viewpoints and come together around a shared vision. I think that's exactly what we're hoping to do.
And the other thing I will say about the root cause mapping is that it's one of those tools that can that pretty much anyone can lead, because you're just continuing to ask the question why and so what and why, and you really don't need, it's a low cost, I guess, tool that doesn't require a lot of resources. You just need people being willing to keep an open mind and explore the possibilities.
Great. Good to know. Low-cost tools are the best.
Yeah.
All right. Well, we're just getting close to the top of the hour here, and I don't see any other specific questions about the presentation, but this has been really wonderful and really has expanded our conversation around health equity and started to unpack a little bit about the cultural competency questions, and thank you for defining that a bit more and giving us a starting point. I think you're absolutely right, and certainly echoed Sean's presentation in that this lens is something that we would want to incorporate in all that we do from now until the end of time, and certainly Plan4Health might be a starting point for some folks, but for others it's midway in the process, and in either case is something that will be incorporated in future work as well. So we do have a brief evaluation survey that's on the screen now. There's a hyperlink there, and it's just a way for us, the Plan4Health team, to understand how we can support future webinars and future TA requests and needs. And it is a requirement if you are requesting continuing education credit through MCHES or CHES credit. So do complete that if that's something you're interested in doing for your own credit. And even if you're not requesting credit, please complete it to give us some feedback and help us grow and strengthen our training opportunities. So with that, I will just put in a quick plug for the next Plan4Health webinar series, and it's February 22nd, so Monday, February 22nd, the end of the month. From 4 p.m. to 5 p.m., we will have a Plan4Health Communications crash course. The first 30 minutes will really focus on the Plan4Health messages. So APA's communications team has developed a few particular talking points that we hope will be useful to you as you talk about the project on the local level and connect your work back up to the national movement to build healthy, vibrant communities. And then the second half of the hour, from 4:30 to 5, will feature the APHA communications team and some social media best practices. So we hope that that time will be well spent and useful to you all as you're launching your work. And with that, I will thank the team at APHA. Thank you so much, Pia and Sean. This has been a wonderful way to spend a Friday afternoon. And we will put the recording on the Plan4Health website and make sure that all of the resources that we discussed today are available to you all. Thank you so much.
Thank you.
Thank you.
Bye, everyone.